I actually started at SGMC with no healthcare knowledge whatsoever. I worked at a business that did sales out of Jacksonville, decided it was time to come back home and applied to work as a receptionist at the Smith Northview location. From there, I advanced into registration and decided I wanted to follow my career in nursing. And I reached out to Lindsay Broom, and she explained to me about the nursing scholarship program that's offered at SGMC. And so I took advantage of that program, applied, and got basically reimbursement for me to go follow my dream. I did that I think for 3 semesters that I qualified for that, and graduated in 2011 and have been there ever since. Our patients, they're our top priority. As soon as you walk in the door, somebody's going to be there to greet you, to treat you, and see what's going on with you. They're the reason we're there, so we definitely take advantage of any time we can talk to them, get to know them, and try to help them in whatever way possible, whether it's physical, mental health reasons, they just need to talk to somebody, or in my case, to have a baby. It's one of the happiest moments of their life, and we try to make that the most memorable experience that they can ever have, and we want them to talk about their great experience among the community, so we have more people that want to come in and see us for that. I'd like to talk about an experience my mom had. It's not within my department, but 2 years ago, yesterday actually, I was out of town and came back home, and she was really, really sick. They do not have insurance, so she was very determined not to go get seen. I'm fine, I've got the flu or whatever. And we ended up going to the emergency room, and she was septic. We parted the doors of the emergency room. Between signing in and triage was less than 5 minutes. Between triage and them taking blood cultures and starting antibiotics was 15 minutes. They went above and beyond. I have nothing but good things to say about the experience she had. From her being transferred from the emergency room up to the tower, the care that she's had from handoff to handoff was amazing. And it's because of them that she's alive and here with us today. I'm gonna be honest, my coworkers, they're my family. I mean, we joke around all the time like, you're the family that I never had, you're stuck with me for life. I love the patients, I love what I do. I would like to say we're like the happiest place on earth next to Disney World up in labor and delivery. We do happy things. I just love family, the atmosphere that we have, the teamwork, the cohesiveness, and of course our patients. Our patients make our day so fun. And just to be a part of that moment for them is just, every day when I leave, I feel like I've helped somebody, I've brought something positive into their life, and a memory they'll never forget. I would say SGMC is a place that you definitely feel at home at. You have teamwork there, you're never alone. There's places for advancement. In my defense, I started no healthcare whatsoever, didn't know what an order was, didn't know anything about that, and now I'm a nurse. So even if you're thinking about going into nursing and wanting to work at SGMC, it's always great to start somewhere and kind of see how it feels. Even in registration days, the cohesiveness of SGMC has been nothing but a whole. Everybody works together. Like I said, you're never alone. There's always somebody there to answer your questions. They offer a great retirement plan, great health care, great benefits, and you just feel like you've done something great with your day when you clock out and go home to your family. You feel like you've accomplished something with your day. So SGMC is really a great place to work for in our community, and it gives back so much to our community. The friendliness that Valdosta offers is bar none compared to anything elsewhere, in my opinion. This is home to me. Everybody speaks when you walk by. Everybody's concerned about how your day, if you say, how are you? It's not just an automatic answer, I'm great, how are you? They are legit responded, I'm great, how are you doing? People care about each other around here. The community comes together. Whenever there's a crisis, the community binds together. Whenever there's something to celebrate, the community comes together. And that makes Valdosta one of the best small towns in the USA to me. So a friend I worked with told me about the scholarship program that SGMC offered for upcoming nurses. It's a work scholarship program. They help you pay towards tuition, and they guarantee you a position at the hospital after graduation. So in my eyes, that was a win-win for me because I would have a guaranteed job after I graduated, and also that helped the financial burden because the school I went to did not offer student loans, so we had to pay everything out of pocket. I reached out to HR and spoke with the HR there, and they gave me the details of the scholarship. I applied and I was approved for 3 semesters, and that tremendously helped us get me through nursing school with a family. I feel like, everybody has a job when you come to work, but you can make it a good, happy atmosphere when you're there. I know we all have our bad days. You have to drop it at the door, just come in with a fresh start. You got to realize these patients are here, and they're here for a reason, whether they're sick or they're there to celebrate the happiest moment of their life. You have to be the face that they see. You're the face for that hospital. You're the face for that moment. You're the face for everything for that patient. You're their advocate. You're there for them, and they need to know that. And it's always kind of nice for them to kind of relate with you. If you go in and you're smiling and you're like, hey, I'm gonna be taking care of you today, they're like, great, somebody is happy to be here, and I know I'm in really good hands. So I feel like that's my idea upon just always being happy and making it a fun time. When it gets serious, and we know how to flip the switch real quick and flip our serious faces on to help somebody, but we try to make it happy for them, and that's one less stressor that they have while they're at the hospital.